everyone, and good afternoon. Thanks for joining us again for another conversation about some of the science underlying the COVID-19 pandemic that we're all dealing with right now. Today, I wanted to talk about the public health strategy of contact tracing. This is an incredibly important approach to trying to confine the spread of an epidemic before it gets too widespread in a community. Now, the principle behind contact tracing is relatively simple. The idea is when you find somebody who's been infected, you consider them as being patient zero, and you start asking them all of the places that they've been, where they've eaten, where they've slept over the last few days or however long the potential incubation period for the disease might be. And you start trying to track down every person that they might have come into contact with. Once you establish that network, you have to personally get in touch with each one of those people, and then isolate them, test them, and treat them if they come out with the disease. And again, the idea for this is that if you can maintain that ring of people that you can keep track of, hopefully you won't get past that ring as they might continue to infect people without knowing it. A bit of history here. One of the early applications of this strategy was actually developed in Leicester, England, near the end of the 1800s, early 1900s, during some ongoing outbreaks of smallpox. And the idea that was developed in Leicester was to build actually a new hospital that was specifically for people with the disease. So when they would find somebody who had been infected, and they actually gave incentives to the community to file these reports to make sure that they caught them right away, patient zero would be confined to this special hospital. And then they would track every single person in the community that patient zero had come into contact with, and isolate them, quarantine them, and eventually they even started vaccinating them early to try and contain the spread of the disease. And so this strategy of doing targeted contact tracing and vaccination ultimately led to the eradication of smallpox worldwide. So it's been shown to be a very effective strategy. However, the problem in 2020 is that with all the global connectivity that we all have and the vast social networks that we have, contact tracing gets really hard really fast. For one thing, it depends on people's memory. It's hard to remember where you've been, all the places and all the people that you've talked to. And our networks are so big that it's also really time and resource intensive to track down every one of those people. And so you very quickly get to a point where instead of being able to isolate and do contact tracing for those individual patient zeros, it ends up being like whack-a-mole. It's just not possible. And so you have to do more widespread social efforts like the widespread social distancing and lockdowns that we're seeing today. Now, the question is, it's 2020, we also have a lot of technology at our fingertips. And how can we leverage some of this technology to take a new, much more technology-driven approach to contact tracing? We started seeing that in China, where the government actually automatically pulled GPS location data from people's phones and used that as a way to contact people that patients with COVID-19 had been in touch with. South Korea is another country that's taken a different approach to this. While they have not automatically, without consent, taken information for people's phone, they're publishing the locations and movements of patient zero with really radical transparency, as they call it, using information from credit card swipes, from security cameras. They're actually publishing names, locations, ages of people who are infected and using that as a way to get in touch with people who might have been in contact. As you can imagine, both of those strategies have raised concerns again with privacy. To what degree can we sacrifice our personal information for public health? So there are some new efforts that are trying to take a different approach that are more of an opt-in participation in this kind of technology-based contact tracing. In Singapore, a new app has just been released called Trace Together. This, again, is an opt-in. You have to download the app and choose to participate. And for 3 weeks after you download it, it will automatically track your location and keep a record of it. If you turn out to be infected, you can then share that 3 weeks of data with the government, and then they will go through your data and then contact other phones of other app users that you may have come into contact with. So it's not as widespread, but it's again, it's a way to use your phone's automatic tracking technology to collect that data. There's another app in development right now that's being developed by a team from MIT, as well as software developers around the world, called PrivateKit. And this one is going to be a little bit more privacy oriented in that it never actually sends the data to a central government authority. It stores the data on your phone. And when other users also have that data on their phone and they come into contact, then there's phone-to-phone communication once a user has been identified as being infected. Now, the key here, though, is with both the app in Singapore and the new app in the US that's being developed, they really rely on people's willingness to participate in it. And that depends on the level of social trust that people have. You know, whether or not you choose to participate phone to phone with PrivateKit or phone to government, like the Trace Together app, you know, it really depends on a level of trust about your personal data, as well as how much that benefits society based on what you give up. You know, what's interesting is that if you look at surveys in South Korea, 78% of people are willing to give up some of their personal data in order to protect public health. I don't know if that's true in every country. And so these are some of the social issues that will influence how we're able to then implement technology. Interestingly, a number of tech companies are just recently coming together to put together a digital hackathon to try and come up with strategies for addressing the COVID-19 pandemic. And contact tracing is actually one of the priorities that's been outlined. So if you have a great idea for how to use technology to improve the strategy in 2020, this hackathon may be your chance. So go ahead and check it out. Thanks for joining us today. We'll be back again tomorrow with a special episode of this conversation. I'll be joined by my 9-year-old co-host to do a kids question and answer session. So if there's a kid in your life who has some great questions about COVID-19 that they'd like to talk to us about, send those questions to us and we'll talk through them tomorrow. Thanks a lot.